Hi, I'm Gary Bebow, CEO of WRHS Health System, and this is my August CEO Connection. Starting in July 1st, our first class of internal medicine residents have begun. On the Friday before that, or on June 30th, we did a matriculation ceremony that was just greatly successful, with Governor Bebow here to give a speech and welcome these 10 new residents to WRHS Medical Center in Batesville. So behind this program, it sure didn't happen easily or by chance. Instead, we've had just wonderful, excellent professional guidance by the two fellows to my left over the last couple of years. And so as my guest today, I have Dr. Cal Cassani, who's the program director. Dr. Cassani, who works with us part-time out of UAMS, and also I have Jody Smotherman, who's our administrator of the graduate medical education. So I've invited him today to just talk a little bit about the program and how we got to where we are today, and also well, how they think things are going. So Doc, why don't you talk a little bit about that? What's going on?
Well, thank you for inviting us to be at the CEO Connection. It's a pleasure to be here. The program started, the process started last June when we submitted for accreditation to the ACGME, which is the Accreditation Council for Graduate Medical Education. We got our approval in January, and we went through the process, and we were able to recruit 10 residents. And as you mentioned, we had the great ceremony on June 30th, and the 10 residents started working July 1st. It has been a very smooth transition. The hospital, the community, and everybody is so open to the idea and very supportive, and I think we are on our third week and nobody quit or complained, so that's a huge success.
Yes. You know, everybody has been so pleased with these 10 you guys selected. You know, they're just not only bright, they're just really good people, aren't they?
They are excellent. We went through we received 766 applications through the software that we use, which everybody else in the country uses. And out of those, we invited 83 candidates to come on campus. They had a full day of interview. I interviewed them, Dr. Smotherman interviewed them, faculty members interviewed them, and we really picked the 10 that we really liked the most, and we were fortunate enough to get them. So we feel like we had a good recruitment season, and in September the recruitment season opens again, and we're hoping to have another good recruitment season again.
I know everybody's really looking forward to it. Frankly, I think we're a little bit surprised on the overwhelming response of interest. Were you I was kind of surprised that we had so many people interested in coming to Bebow, being that it's our first program.
It is surprising, but for a couple of reasons. One, you know, we are in a rural area. Two, we really had a disadvantage because most of the recruitment cycles start in September, and because we got our accreditation late in January, our recruitment process was late. But I think, as I mentioned, the support of the hospital, the administration, the community, the medical staff has been overwhelming. So everything that we needed to be done, we were able to do it quickly. Everybody was very impressed during the interview season. Our website went online very quickly. So I think we are very fortunate. Also, you know, there is a lot of graduates who are looking for postgraduate education residency spots. So we are in a good time to be able to provide these spots for these physicians who are looking to advance their training.
Well, I can't tell you how much I appreciate the hard work you've done to get us to this point. Well, Jody, talk a little bit about yourself. I know administratively you've been with the hospital for a long time, and what about January of 16 is when you actually took on this job full time, wasn't it? And you've really grabbed a hold of it, and I know you really felt fulfilled career-wise in this new job. So why don't you talk a little bit about the
started in June of 2003, so been here 14 years, and started with this role January 2016. And when Dr. Cassani came on board, and then Mary Woodcox and Dr. Morgan Norton, we've had a good team. We did a lot of work fast, and it was very tedious work, but we had a good team. It was very challenging, but it's been the most exciting job I've ever had. And now to actually have the residents here, seeing them on campus, seeing how the community's responded, it's been very rewarding.
Yeah, you know, I know you've told me before that we're kind of a unique program when it comes to residency program, and some of the things we're doing right now may become used at other rural communities in the future as well.
Absolutely. The Internal Medicine Review Committee for the ACGME, when we proposed our model, Dr. Kasani being at UAMS in here, us having most of the training here, and also at UAMS at Academic Center, they had never seen a model like ours, and as such, they've told us this is one of the most innovative approaches they've seen. And in fact, in March at the national conference when we were there, they've asked us to write this and publish it in the Graduate Medical Education Journal, and they've already passed our template along to 2 other hospitals.
Yeah. You know, we surely shouldn't conclude this conversation without giving accolades to UAMS, not only to allowing Dr. Kasani to be a part of us, but also they'll be instrumental in our rotation and just support for our programs. And so heads off to UAMS and Dr. Ron and the folks there that worked with us hard to make this happen. So we're really fortunate there. You guys got anything else you want to give us? These new residents are here, and like Dr. Kasani said, we haven't had any major disruptions in the first few weeks of the program, and I can only see it getting better as time goes. So
the primary reason I think the first few weeks have went very smoothly is we were told when we started the most important hire is your program coordinator, and Mary Woodcox has done a great job as our program coordinator. Over the past 2 weeks, I can't tell you how many things she's handled for the residents to make sure that they're getting involved, but also if they have needs, she takes them very quickly, and they've all complimented her on the job she's done.
You bet. You bet. It was a 3-year program, so we got the first 10 on board.
Yes.
In July of 18, we'll have 10 more on board, so that'll get us to 20. And then in July of 19, we'll get our final 10. So in just 2 more years from right now, we'll have a full complement of 30 residents in training at internal medicine, each with the different stages. So this is exciting times. And of all the things I've been involved in the last 26 years, this really is one of my top ones that I feel so good about, the difference we've made to Batesville and White River Medical Center, and so I'm really proud of you all, and thanks so much for your role in making this happen.
Well, thank you for your support. This has been, your support has been very important. It takes a vision to get where we are now, so definitely you deserve a lot of credit for your support and for your vision to have a residency program in Batesville, Arkansas. So, and that's very important to have a successful program, because every now and then you will hit a bump, and if you don't have the support of the administration, you wouldn't be able to pass it very quickly and overcome it. So thank you for your support and for trusting us with this important job.
Awesome. Thank you. Appreciate it. Each month, Stone County Medical Center and White River Medical Center appoint Employees of the Month. At Stone County Medical Center for this month, Heather Lancaster from the laboratory has been selected as their Employee of the Month. She's been with us some 12 years, and she's always noted for being helpful to co-workers and providing great quality care. So Heather, congratulations. At White River Medical Center, Lori Pinkard from IT is a systems analyst that has worked at White River Health System for 27 years. Lori is the White River Medical Center Employee of the Month representing prompt service. I've known Lori for, well, almost all of my tenure as well, and she's a great selection for Employee of the Month. And so if you see Lori and Heather this next month or so, be sure to recognize them for their accomplishment. So congratulations. As a follow-up to last month, we still need volunteers to assist us in our prostate screening on September 19th at the Ray Rogers Women's Center conference room, and also at Health First on October 17th. We need additional volunteers too. So in each of those cases, if you're able to volunteer during one of them, be sure to contact Bailey Williams at ComHealth for information. Finally, I wanted to mention today that White River Diagnostic Clinic has become a part of White River Health System effective on July 17th. Doctors Neville, Barnes, Kirkendall, and Boyke are now a part of our employment, and they're all the employees from White River Diagnostic Clinic. Some 40 or so are now employees as well. So at least initially there will be no significant changes in the practice or locations or any of those things, but we're really proud to have that group join us as part of our team. And so if you see any of the doctors or employees from White River Diagnostic Clinic, be sure to welcome aboard. They're a really important part of our future planning. You may have followed in the newspaper that White River Medical Center has requested the closure of Broad Street between Sydney and 15th Street, just west of the hospital's campus. The purpose of requesting the Broad Street closure was so that we could build another medical office building of some 24,000 square feet, most of which will be dedicated to musculoskeletal type care, which means like Dr. Allen and Angel and Carpenter, and a year from right now, Dr. Greer, all orthopedists, will work there as well as we'll have imaging, and we'll also have physical therapy in the new facility. On the second floor of the facility, other specialties like rheumatology will likely be housed there as well. So it'll be really a one-stop shopping for musculoskeletal services. So in order to make that happen, we went to the City Council and asked for a closure of Broad Street, and I was really pleased with the support we got from Mayor Ellenbaugh and the rest of the City Council to allow that to happen. So that paves the way for our architects to do the final drawings, and I would expect that we will start we'll do a groundbreaking and start that project probably sometime later in the fall. So I know it's a big undertaking for us, but certainly one that's necessary as we expand our service offerings at White River Medical Center. That concludes my CEO Connection for August. I hope you all have a great month. Thank you.